So I have endometriosis, misunderstood,
PCOS,
undiagnosed,
endometriosis, PCOS, adeno.
Have you ever Googled your symptoms and you felt more confused than ever before? Painful periods, bloating, overwhelm, hormonal imbalance, the list goes on. Could it be PCOS? Could it be endometriosis? Could it be both? Well, in this video, I'm gonna give you the exact differences that's gonna allow you to come away feeling a lot more clear-headed, a lot more clarity, and actually be able to know the exact difference that you are experiencing and having clear steps going forward. PCOS stands for Polycystic Ovary Syndrome, which I have gone in depth about in another video I will put up here for you, and I highly recommend you go check that one out, but for now, I will go over the basics. It's a hormonal and metabolic condition that affects ovulation and obviously your hormonal cycles, and it can have side effects. The side effects can be acne, hair loss, hair growth in certain places you also don't want, weight gain, constant ache in the uterus area, and it could also have irregular cycles. And my favorite that I have had previously is fatigue and mood swings. It's often rooted in insulin resistance, chronic fatigue and inflammation, and nervous system dysregulation, which is one I suffered for years. Endometriosis isn't actually a hormonal condition, it's a chronic inflammatory condition. It happens when tissue similar to the lining of your uterus grows outside, and it can actually grow on your bladder and other organs around your uterus area. It's also very common for it to grow around your fallopian tubes and your ovaries. Common symptoms of this is severe period pains to the point where you're not able to work. You can often get this in your luteal phase and your menstrual phase. Some women experience it every single day of the month. This is a very extreme end of things. You can have pain during sex, heavy bleeding during your menstruation, as well as fertility struggles. And of course, there's all the pelvic pressure, the inflammation, the bloating that comes along with that as well. And that is why I can see how endometriosis and PCOS can be closely tied and often misaligned, misunderstood, and some women actually think, which one am I? So for my visual learners, I'm gonna put it up here for you of the visual diagram of the differences between endometriosis and PCOS. So you're welcome to pause this, screenshot this. I actually highly recommend you do that, because then you can go away, come back, and actually digest, learn, and sleep on it. Here's where it gets messy. The average time duration for a woman to be diagnosed can be anything between 7 to 10 years. I've even heard studies saying 10 to 15 years in the US. Many women can have both, but often diagnosed with one, and that is the PCOS. Because when we have endometriosis, you have to go through surgery to be diagnosed with it. And that is often where women go through that decision making of, do I go through something to validate how I am feeling to try get rid of pain, or do I go through the thing of, I know I have this and I'm experiencing this, so I'm going to do every healing modality to be able to help me and not go through surgery that is invasive. You might have irregular cycles, painful periods, heavy bleeding, and that is why most women get diagnosed with PCOS. But years later, still in pain and nothing has helped. That is why it's so crucial to work with a practitioner that specializes in either PCOS or endometriosis, because they will know how to treat and also how to be able to look at every single individual as a new case and not fit you into a mold, into a label, into a group of generic women. If you're unsure on which one you're dealing with, I highly suggest track your symptoms for the next 2 to 3 cycles. So that is on average 3 months. Some it can be longer. Get full blood work, hormonal, insulin, inflammatory markers. Ask your doctor about pelvic screening, because this is gonna be able to help you see visually what is actually going on. And if you're in severe pain where you cannot work, you cannot sleep, you cannot carry on with your life, I would highly recommend seeking a gynecologist, which is what I did, to be able to help you at least get the next steps and actually feel that you are working with someone very promptly, quickly, and you are your own scientist of your body. No one can tell you otherwise. If you are feeling a certain way or experience certain symptoms, do not dismiss it. Seek help help from a gynecologist or endometriosis specialist as soon as possible. And often if there is someone who isn't specialized in it and you find that you may get dismissed, just know there is other paths available to you. And of course, you're more than welcome to comment below your comments on this topic and your own experience through endometriosis and PCOS. And if you're navigating PCOS, I have created the right community for you, which is the Body Up Project, where we focus on healing through guided nutrition that is not so hardwired and so hard on it. It's an intuitive way of eating, fueling your body for the best outcome, which is to be reversing your PCOS as much as possible, as well as tailored workouts bespoke to you, and most importantly, able to self-regulate your nervous system to be able to be in a less high cortisol, high stress state, to be able to actually live the best life you truly deserve. So I will put that in the description below. And YouTube has a very funny way of recommending videos that are highly suggested to you, for you. It will be up here. I highly recommend you go click it. I will see you on the next video. Mwah!